Hi, my name is Justine Evans, and I'm going to explain to you how to use the multi-drug saliva test. This test is to see whether you or another party who will take the test have any of the drugs in their system. The saliva drug test is a screening test for simultaneous qualitative detection of amphetamine, methamphetamine, cocaine, opiates such as morphine, marijuana, benzodiazepines, and oxycodone. This test uses monoclonal antibodies to selectively detect elevated levels of specific drugs already outlined in human oral saliva. Each of the tests is read individually and independently of one another. First, I'm going to show you what is in the kit. There is one collector cap, one collection chamber, a sponge, test strips. The process is simple. Before doing the test, make sure you or the person you are testing has not placed anything in their mouth for at least 10 minutes prior to collection of the oral fluid specimen. This includes food, drink, gum, or tobacco products. How to do the test. Today, I'm going to demonstrate using the test on Janine. At home, it is quite simple to do the test on yourself. Firstly, unscrew the collector cap to pull out the collection stick with sponge from the collection chamber. Then, insert the sponge and the collection stick into the mouth. Close the mouth and gently chew the sponge for saliva secretion. Soak the sponge and saliva in the mouth and swab the inside of the mouth and tongue to collect saliva for at least 3 minutes, until the sponge becomes completely soft and fully saturated with saliva. The sponge must be completely saturated with no hard spots left on the sponge before the next step. Once the sponge is fully saturated, remove the sponge from the mouth and place the collection stick into the collection chamber. Secure the cap and start the timer for 10 minutes. And after 10 minutes, we are now going to interpret the results. In this case, the result for all 7 drugs is negative. 2 coloured lines have appeared. Both the T test and C control lines have appeared. This indicates that the drug concentration in the saliva specimen is below the designated cutoff level for that specific drug. The shade of the colour in the test region T may vary, but it should be considered negative whether there is even a faint coloured line. If the result was positive for any of the drugs, only one line would appear in the C control line. This indicates that the drug concentration in the saliva exceeds the designated cutoff levels for that specific drug. If the result was invalid, one coloured line will have appeared in the test region T. This is likely to be caused due to insufficient specimen volume or incorrect procedural technique being used. Review your procedure and repeat the test. If you have any further questions on using the test, please contact the pharmacist where you purchased the test from or contact Smith Biomed at info@smithbiomed.com.